Good afternoon, everyone. This is Caradina Sale with the Mixover Institute, along with the Community Technical Assistance Center and Managed Care Technical Assistance Center of New York State. And I would like to welcome you to today's webinar, Dads and Depression, Paternal Depression in New and Expectant Dads, presented by Dr. Lena Green. Dr. Green is a social worker, a clinical social worker, psychotherapist, and fatherhood practitioner with over 15 years of direct clinical practice with children and families. She is skilled in various areas of mental health, program planning, development, clinical supervision, and building strategic partnerships. She served in New York City government for 18 years and is also an adjunct professor at NYU's Silver School of Social Work. I'm really grateful for Lena sharing her expertise today with us. Before we get started, I want to take a moment to orient everyone to our WebEx system so you know how to participate in today's event if you haven't been here before. So you will be muted to avoid any background noise. If you come across any technical issues, please chat to our host, Boom, who will be able to assist you. And you will have the opportunity to participate in a polling and chat box feature on our right-hand side. So there's going to be 2 poll questions in the beginning that will pop up, and they'll be there just for a second. And then you can answer those. And then also Lena may invite you to chat into the chat box, and we will be helping her to talk about what you all are saying. As a reminder, this is not, we are not really talking about COVID-19, but I know this is still on everyone's minds as it should be. So I just want to remind everyone to view all OMH guidance regarding COVID-19 by going to a link, omh.ny.gov, and you can find guidance around COVID-19. It's also on our website at ctechny.org. Without further ado, I will now pass it on to Dr. Green. Thanks so much for being here, everyone.
Thank you, Kara. Welcome, everyone. We are delighted to have you all here join us this afternoon. This is such a very exciting topic for me, particularly as a social worker and a fatherhood practitioner, mental health clinician, working with both moms and dads, and working with pregnant and parenting families. So we are delighted to have you with us on today. We do look forward to any feedback that you may have, and hopefully this will be as inspirational as it has been for me doing this work. And we look forward to sharing all the information that we have prepared for you today. Okay. So our learning objectives for this afternoon is that you will gain an understanding about the concepts of paternal perinatal depression. We hope that you will increase your knowledge regarding the risk factors related to paternal perinatal depression. We also want you to understand the effects of perinatal depression on children and families, and we'll also share some best practices and some resources at the end that we hope will be helpful to you. Kara, I'm going to turn it back over to you at this time to start with the polling questions, and we have 2 of those for you.
First one, how often do you assess mothers in the lives of the children you work with? This is our first polling question, and you're going to click either A, often, B, sometimes, C, rarely, or D, never. How often do you assess mothers in the lives of the children you work with regarding depression? So we're talking about maternal depression first. Are you assessing mothers often, sometimes, rarely, or never? Okay, so we should be getting the results here in a second.
Okay.
It looks like it's often, so it seems like most of you are assessing mothers for maternal depression quite often. Thank you so much. It's very helpful to see, to hear that. So we're going to go to our next polling question. And this question is about paternal depression. So how often do you assess fathers around paternal depression in the lives of the children you work with? So when your kiddos are showing up, are you assessing their fathers for paternal depression? Would you say often, sometimes, rarely, or never? To choose which reflects the work that you do, assessing fathers around paternal depression. And those answers should pop up in a second. So you're frequently assessing mothers for maternal depression. And so we thought it'd be helpful to see if the same was true for fathers. And it looks like absolutely only a few of you said often. The majority of you said rarely. So I think that really shows the urge for this conversation today, Lena. I'm going to pass it back to you.
Okay. Well, I know that there were only a few responses with regard to often and perhaps sometimes, but for me, that's encouraging, right? As opposed to like never. So it's great to see that you are thinking about this. That is something that is on your radar, even if you do it rarely. I think it's important to at least have the information in your mind and at least be thinking about the fact that dads experience depression during the perinatal period as well. So going on to our next slide. So you might be wondering, I get this question most often when I'm working with people or I'm presenting. And the question is like, why are we focusing on fathers? Why are they even a thought during this time? Mom's doing all the work, mom's, the person who's carrying the baby. And so sometimes when I say it, paternal perinatal depression, even the phrase, I often get a look from folks that it's quite perplexing and they're not sure. So we want to, just talk to you a little bit about why we are focusing on fathers. So the transition to parenthood represents an important event in the life cycle, resulting in increased vulnerability to psychological disorders as fathers adapt to widespread changes in roles, expectations, and demands. And we know that is true for all parents, but again, we want to get you thinking about the fact that this is also quite present for fathers as well. Families are indeed complex systems that consist of individuals who relate to one another in unique but interdependent ways. And we know that the way that they can relate to one another can change over time, especially if those relationships are fragile to begin with. We want to also lift up the fact that fathers are an essential part of the family system and contribute to child development in significant ways. I think that there has been quite a bit of research that has talked about the importance of father involvement, so we won't talk about that too much, but just wanted to remind folks that that's important as it relates to child development. We also want to acknowledge here that father bias must be addressed in the overall culture that often focuses solely on mothers, presumes that mothers are the more impactful parents. I can tell you for someone who has worked in the area of maternal child health over the past, 10 plus years, most of the programs that you see, including the funding that is available for folks, is strictly on parent-child health, and that really means maternal child health. And it really just focuses just on mom and baby. While we know that that is important, but we just want to continue the conversation to make sure that dads are included in the family system as well as an important part of that system. Depression is new. New and expectant fathers is often overlooked by mental health professionals, so we hope to change that perspective on today. And the experiences of fathers are receiving increased attention in literature and media. So I think that, if you can Google or, look up articles, you will see now that information regarding the experiences of fathers or what fatherhood actually is gaining traction there. So we'll talk a little bit about the paternal perinatal depression so we understand a little bit more. So the prevalence of depressive disorders and risk factors during the postpartum period has really grown over the past few decades with increasing awareness and concern about the impact of fathers. And while maternal postpartum depression is well documented, in addition to its impact on child well-being being extensively examined, there is some emerging literature that suggests that the incidence of fathers who experience depression during the postpartum period is currently under-researched, under-screened, and it leaves quite a few fathers undiagnosed and quite often suffering in silence. Um, there is emerging research that suggests that PPD is commonly experienced by new fathers, with prevalence estimate rates, ranging anywhere from 4 to 25% for new dads. And then we also know that men are less likely to report depressed feelings during pregnancy and the postpartum period, which also makes it difficult to account for accurate rates and prevalence. Okay. Typically seen as an issue in the area of maternal child health, we know that the importance of women's emotional well-being during the transition to parenthood, again, is well documented to the extent that, there is specific information that focuses on screening and implementation during that period, during the pregnancy period, and also up to 1 year postpartum. The birth of a child and the transition to parenthood is also one of the most profound events in a man's life, and really involves dealing with major changes in daily living, along with transforming his identity, his romantic relationships, as well as his standing in the community. And in a bygone era, right, a father's lack of engagement and relegation to the role of ancillary helper or provider were acceptable. But I think that today's expectations of fathers is that they not only will be lookers, but that they will also nurture and care for their offspring from the start, right? And so when we look, if we look back at even some television shows during the 70s and the 80s and the 90s, I think that we can see the progression of the role of father and how that has really come into play around nurturing and caring for the offspring, and not just as provider or disciplinarian. So what is paternal perinatal depression? So it is a non-psychotic depressive disorder that occurs before or after the birth of a child during the perinatal period. The perinatal period is defined as the onset of pregnancy to 12 months postpartum, so just really up to 1 year. Researchers have also now acknowledged that PPD is also the product of psychosocial causes. It can therefore be presumed that such factors would also impact on the mental health of involved fathers in the perinatal period and the postnatal period. Lastly, on this side, according to the DSM-5, PPD is a depressive disorder with peripartum. Peripartum is the onset of defined as starting anytime during pregnancy or within the first 4 weeks following delivery. So those also coincide when we're thinking about the baby blues or the postpartum blues as well. So manifestations of PPD in men, similar to mothers, which can include decreased appetite, sleep disturbances, feeling overwhelmed, somatic symptoms, of course, sadness, difficulty concentrating, feeling irritable, and difficulties with bonding with baby. Again, just some additional symptoms, crying more often than usual, worrying or feeling overly anxious, oversleeping or being unable to sleep when your baby is asleep, having trouble concentrating and making decisions, losing interest in activities that were once perhaps enjoyable and no longer so, maybe suffering from physical aches and pains. We also acknowledge that there's maybe eating too little or eating too much, avoiding social supports such as friends and family, again, having trouble or difficulty bonding with baby, persistently doubting your ability to care for the child, and then also in more severe cases, thinking about the harming oneself or one's baby. So wanted to make sure that we talk more specifically about the manifestations of PPD in men, because they are distinct symptoms that you may not necessarily find when you're dealing with women or mothers. And those include increased levels of stress, financial stress. And so, this is an important point because I think that oftentimes Men, of course, have societal pressures that tell them, to be focused on being a provider. And for folks who are unemployed or underemployed, and we'll get into that a little bit later, this can really be a major source of stress and conflict. Anger attacks, so affect rigidity, which may be the failure to express emotion. A lot of self-criticism, so working with fathers, as I have done over the past 15 plus years, this has also been quite prevalent. Risky behavior, and that includes alcohol, drug abuse, unsafe driving. This can also look like, getting into more conflicts at work, perhaps fighting, some more aggressive behavior, though it can manifest in that way as well. Unhealthy sexual relationships or infidelity, escapist behavior, which may include everything from, spending excessive time watching TV, playing video games, or, working more. Isolation and withdrawal from relationships, changes in work, employment, or activity, again, working more or less, and then also poor physical health. We'll talk a little bit about depression screenings for men. So I just want to say that while there are no specific tests for male PPD, sometimes regular screenings for detecting maternal depression are used to assess, most of the time post-birth, and sometimes during pregnancy. I think that there are some programs out there that I'm familiar with, programs like Healthy Families, programs like the Nurse Family Partnership, are definitely screening during pregnancy at particular intervals, and use some tools that are pretty consistent across the board, just based on my work, the work that I've done with both of those programs, as well as others. So the Beck Depression Inventory is one. The Center for Epidemiologic Studies Depression Scale, and the Patient Health Questionnaire, which of course we know is the PHQ-9. And then also the one that I think is most popular, and the one that I think most agencies that I am aware of are using, is the Edinburgh Postnatal Depression Scale, which is the EPDS, which again, they also use during pregnancy. So I'd like to talk a little bit more about that. So the Edinburgh Postnatal Depression Scale was first developed in 1987 by Scottish Health Centres in Edinburgh and Livingston. The higher scores indicate more depressive symptoms, and we'll get into that a little bit more. I'm going to take a second to, Kara, I just want to make sure that I can see the chat. I'm not sure that I can still see it, so I want to make sure that I'm taking, make sure that I'm able to see if any questions pop up in the chat or answer. Okay, so I can't see it at this moment. I just wanted to let you know. I'm not able to see it. Okay, if there are, please feel free to flag me. So the EPDS is now well established in the prenatal and postpartum periods in women, and has been translated into several languages. EPDS was developed as a screen specifically for PPD in women, so not men, but it has been used for men. It is a self-administered 10-question quiz in which participants rate how they have been feeling for the past week, electing from 4 possible answers for each question. The highest possible score on a test is 30, indicating the most depressive symptoms present. And of course, the lowest possible score is 0, indicating the least depressive symptoms. So just a little bit more background on the EPDS. So scores from 0 to 9 in this range may indicate the presence of some symptoms of distress that may be short-lived and maybe not likely to interfere with day-to-day ability for someone to function at home or at work or function optimally. However, if the symptoms have persisted for more than a week or two, we suggest, or the tool suggests, further inquiry is warranted as to the cause. of those symptoms and challenges. A score of 10 to 12 within this range indicates the presence of some symptoms of distress that may be discomforting. And we suggest that, that it's repeated in 1 to 2 weeks time for scoring. Again, just to check in with a mental health professional. Again, and you can do that and repeat the screening as often as necessary, or as often as the guidelines from maybe your agency or program recommend. And then for a score of 13 and above, really any scores above 12 require further evaluation and a possible referral for mental health treatment. And again, ongoing screening to monitor symptoms and progress. Okay, someone is asking where we can find those quiz. Again, sorry, I just want to say that I can't see the chat. Okay, I'm back, I think.
Someone's wondering where they can find the quiz.
The EPDS?
Where they can find the Edinburgh. Mm-hmm.
Yep, you can certainly Google it. They have several examples online. So it's very easy to get to. Okay.
Great. Someone also just chimed in, just so you know, I work with families who have an open case with CPS. Part of my work is to do plans of safe care after a baby is born. I had never thought to ask Dad how he's doing as well, but it makes sense.
All right, that's great and incredibly encouraging. So we hope that you will incorporate this into your work. And again, my information will be available at the end of the presentation. And so we hope that I can provide, I'm happy to provide more support if folks are in need. So, okay. So let's talk a little bit about some of the risk factors for paternal perinatal depression. So although the research is still in its nascent stages, the available literature suggests several risk factors that have been identified as contributing to paternal perinatal depression. So some of the relational factors include a partner with maternal depression. And it said, research just shows that if if the partner has depression during this time period, that dads are more likely or have an increased rate of depression as well. Lack of social support is a risk factor. Unplanned pregnancy is also a risk factor. So we know that most pregnancies, and I don't have the number offhand, but we do know that the majority of pregnancies in this country are not planned. And so that is a big challenge that we're often working with parents around in unplanned pregnancy and what to do now and how to go forward. Father absence is also a risk factor. So for many fathers that I work with in the community, and I'll talk a little bit about that more as we get further into the presentation, not having a father is a huge risk factor, especially relational factor, because they don't really have any scaffolding for what it means to be a dad and to parent. Also problems in the partner relationship. So if there is any interpersonal conflict that's happening in the relationship, that's certainly a challenge. And for those families, we definitely want to see if we can get some support for them. Sometimes it's mediation, sometimes it's a co-parenting class, or sometimes it's just starting the conversation around, communication. How do we communicate? How do we want to get better at communicating to at least start those conversations so that we can help children start out in healthy and probably home. So a history of psychiatric disorders, so any depression and anxiety, those are most common. Educational level. So for folks who have a lower educational level, let's say you never graduated high school, you never went to college, that's also going to be a risk factor for you. Paternal age. So we also know that young fathers are at greater risk for paternal perinatal depression. And so I just want to talk a little bit about young fathers for a second. I'm not sure how many people have the opportunity to work with young fathers, but here where I am in New York City, we have sort of two main groups of fathers as it relates to paternal age. So we work with young dads, which is considered 16 to 24, and then older dads, which is sort of the 25 plus range. And they come with very different challenges that, really we have to really focus on. Okay. Also employment, unemployment, or underemployment, right? So going back to the thing that we mentioned earlier with regard to pressure to provide, this could be a huge issue for folks, particularly as it relates to, again, just providing. It also may mean for families who have children in more than one relationship. So if there's a huge part of their income, going to one family, we're going to think about, now having a second child with a new partner, how that may impact one's income or one's employment ability. So here we're going to talk about a little bit about the impact of paternal perinatal or postpartum depression in children. So paternal depression can negatively affect infant care and bonding. It's stressful to the family unit overall and has been linked to later child psychopathology. Some studies have found that offspring are more depressed or at higher risk for depression than parents who do not experience depression. Conduct and emotional disorders, hyperactivity, as well as delays in language were also found. Behavioral problems or behavioral challenges, which include temper tantrums, sleep patterns, neurotic and antisocial behavior. Also some delays in cognitive development. We also found that some untreated PPD is also associated with increased incidence of psychiatric disorders in children as well. And then studies that control for gender show that paternal depression may be more associated with externalizing problems such as behavioral issues and substance abuse, whereas maternal depression appears to have a closer link to mood and anxiety problems in their offspring. And again, some studies have shown that. So the impact of PPD on partner and family overall, again, untreated PPD has been shown to negatively impact the entire family system, including children's social and emotional development, behavior and attachment. The partner, few positive behaviors such as warmth, sensitivity, and responsiveness, and increased negative behaviors such as disengagement and hostility. And as I mentioned before, that can also, lead to quite a bit of conflict in the relationship. So I wanted to share a story about one of the fathers that I work with, or worked with. His name is Quentin. He came to the program that I community called Fathers First. And he came to the Fathers First program after finding out that he was going to be a dad for the first time. When he came to our program, he was 25 years of age. He was a college graduate, and he was expecting a daughter with his partner of 3 years. Quentin was also unmarried and living separately. So he was actually living at home with his mom and sister, and came to our program quite distraught and quite concerned, quite anxious about the fact that, he was having this unplanned pregnancy, and although he loved his partner and wanted to continue the relationship, wasn't sure how that was going to impact his life, their lives together, and certainly any plans that he had for the future. When he came to us, he didn't have any faith in himself at all. He was actually a member of a fraternity group, which is how he actually got referred to our program, which is always a good thing when there's information in the community, and folks in the community can also vouch for your program. So we always applaud that and are very excited when we get community referrals. So he was referred to the group from a mentor who had also gone through the program and who did not quite serve as a father figure, but at least was a mentor for him during this time. He felt like there were a lot of expectations of him during this time. He had a lot of fears. And And he also had shared at the time that he came to the program that he had a brief separation from his girlfriend because some of the conflict, and so that there was he was also concerned that the relationship was going downhill, and he wanted to be present for his child. We provided the Edinburgh assessment to him, and he did score around a 20 or so. He also shared that he had difficulty sleeping, that he was working quite a bit to avoid some of the conflict with his, with the mom-to-be. He also expressed and shared that he was drinking quite a bit, especially after work hours. He also talked a little bit about smoking, marijuana and how that was helpful for him. Again, he had a depressed mood. And then one of the things that he shared that was really a source of conflict for him was that his father had passed away in a car accident at the age of 9. And so he really didn't feel like he had, again, any scaffolding or any examples of what it meant to be a good father. So during this time, and we'll talk a little bit about that and the resources, he participated in the fatherhood group on a weekly basis. He also had some one-on-one individual counseling where he was able to, share more about his expectations, his fears around being a dad. And then, we were able to talk about, who were the good examples. So there's one activity that we use called TV dads. And so we take a look at some TV dads and we talk about some of the good qualities that those fathers possess that you want to incorporate in your own life. And so now, although Quentin is no longer with the mother of his first baby, he is actually doing quite well. The first relationship, there was a demise in the romantic relationship, and so they parted ways. But he is still in the life of his daughter, and he is now currently married with an additional baby girl with his new partner. So we like to think of Quentin as a success story, and he continues to be a positive voice for us in the community, referring fathers to our program, and really just singing the praises of all the things that he's experienced during his time with us. Okay, so going back to treatment for PPD, again, approximately 10% of fathers will experience a depressive episode at some point during the perinatal period. This is actually twice the rate found in the general population. Again, while there is no specific treatment or studies or guidelines that provide directions or best practices for PPD, we do have some promising practices that we'll talk about. This is in contrast to maternal perinatal depression, where there are several treatment guidelines, including some manualized psychotherapy, such as interpersonal psychotherapy or cognitive behavioral therapy, and psychopharm recommendations. Okay. So the overall standard of care, for treating PPD generally continues to be antidepressants, of course, and psychotherapy and/or both. Men are more likely to agree to psychotherapy if that option is presented as a way to protect or restore some aspect of their masculinity, as an ability to provide for the family or contribute to the family's well-being. Also, getting men to seek help when they are depressed can also be a challenge. I can tell you that even, during our screenings, when parents first come in, they are quite reluctant to, be assessed for depression. But I think, I think it really speaks to, the lack of education around depression and, also reluctance to get tested or screened because of stigma. So. All right. We'll talk a little bit about some of the interventions that the literature discusses, including some of the ones that I've implemented in my fatherhood program. So interventions delivered during the antenatal or pregnancy period include parenting education classes, focusing on the physiological, psychological, and general process of childbirth, right? I know that for many places, classes are offered to both parents, right? But what we've learned during this work is that really dads require a unique space that are specifically carved out for men, where they can really, bond and have an opportunity to speak with other fathers about their experiences, and also speak with practitioners who have a focus also on men's issues, and then working with men around parenting. Interventions also focus on understanding the role of father and what to expect as a new father. Clarifying partner support expectations, right? How are we going to do this thing together? What roles am I going to take on? What roles are you going to take on? We also know that helpful during this process is preparing for labor and birth, focusing on areas that specifically hone in on caring and nurturing for baby, understanding breastfeeding as well, thinking about childcare and household tasks, and then additional resources, right? So educational resources, financial and employment, then child support and family court help. And so I just want to go back to, specifically the educational resources, specifically for young fathers, and we're talking about, the 16 to 24 age group. Quite a few of them often have early exits from the educational system. So that is something that we certainly want to remind ourselves of. We want to encourage dads, especially young fathers, to continue with their education. We know that is one of the tools of getting out of poverty, right? So if you are poorly educated, then you're going to have a more difficult time being able to find a job to sustain you. And we really want to steer, our dads towards, above ground employment. Sometimes, you'll have dads working off the books so that they can make ends meet. And also, if they are in multi-fertility, if they have multi-fertility partners, just really meaning that they have a child with more than one parent, they may be engaged in the child support or family court system. And so, we want to think, how do we help support those families so that they can, be present both physically, emotionally, spiritually, and financially in the child's life. And then how do they do that without compromising support to the other children in previous families? So some promising practices. We've shared pamphlets for men, specifically focusing on PPD and the normal stresses and changes that accompany caring for a new baby. And these things can be sent home with moms if dads aren't present. These pamphlets can be provided when parents come in to the OB clinic, or they come from a postpartum visit, exam, or pediatric visit. We also want to lift up prenatal classes that those can be offered that are specifically designed and exclusively designed for men and taught by a male-centric instructor. I can tell you how many times that perhaps folks want to be able to provide this information, but it's done sort of in a catch-all way. So we want to be mindful that we want to be specific about providing material and tools that specifically appeal to men, and also done by people who also have an investment in supporting fathers during this time. In some agencies, there's a telephone helpline for designated counselors to answer any questions with dads about depressive symptoms and then additional services in working with fathers, which can include weekly support groups, father-child activities, and then also family-centered activities. So I wanted to just talk a little bit about the Fathers First program and some of the focus areas that we hone in on. So our areas of focus and priority include parenting services. So we provide additional groups that fathers can come into on a weekly basis that focus on an array of areas, which we found have been quite helpful. And again, it's an opportunity for guys to come together, to share, to bond, to learn from one another, and then also gain some important and practical skills. Mental health, of course, child support and paternity, which we mentioned earlier, focus on, building healthy relationships. We know that we can get in early, especially to support those young parents and those young families, that the earlier that we can provide support, the better. And the better, the relationship has a chance of being, promising. And then focusing on community-based collaborations. So we often partner with other community-based organizations in the area. We focus on resources, anything from, focusing on food insecurity to childcare, healthy cooking classes, breastfeeding support classes that are outside of, having a presenter provider come in for a one-time presentation. So just really thinking about, what other community-based collaborations and organizations can you provide to dads? Also thinking about, any partnerships that you can have with educational systems. And for dads who are looking for work, that's going to be really important as well. So if you can develop any relationships with employment agencies or job readiness programs, those are also quite helpful. So the Fathers First program is a place where fathers can come together and talk, and they talk freely. It's an organizational movement. We consider ourselves a movement that seeks to inspire, mobilize, and equip fathers to become good influences in the lives of their children for life. And then we offer four basic programs. So we offer Daddy Boot Camp, and we'll talk a little bit about that a little bit more. We offer, going back to Daddy Boot Camp, it's a brief program, a couple of hours. So we've done that program going out to schools. I'm not sure how other states work, but for here in New York City, we have essentially daycare centers that are connected to the Department of Education, where parents can get free daycare if they are enrolled in school. And that's not a resource that every single school has, but it is a resource that some schools have throughout the city. Can sign up for the program, so moms and dads can sign up for those programs. So we've been able to go in and teach a class, a boot camp class for new and expectant dads. Also, Dr. Dad, which focuses on 4 areas, practical areas that fathers can do and really hone in on to care for the baby. 7 Habits, and also another program for 7 Dads. So just talking a little bit more about our conclusions here. So paternal PPD is, again, relatively a new field of study, but it is getting more established as the rate of depression in men during the postpartum period exceeds that for men in a larger population. This disorder, again, affects not only men themselves, so their children and their romantic partners. And although there's a perfect screening tool that exists for detecting PPD, the same Edinburgh that is used for women appears to be a valid instrument for screening men. Our main challenge at present is getting men to seek help when they do feel anxious, when they feel overwhelmed, when they're angry and or sad. Educational and treatment programs that specifically target men experiencing PPD may make a significant contribution to the overall mental health for men and also the entire family. We want to lift up future research because we wanted to better focus on education and public awareness about maternal perinatal depression so that we can also develop better screening tools specifically for men, and also talk more about best practices and treatment alternatives to psychotherapy and education. I think that there was someone who mentioned mediation as a treatment for male depression. So thank you for that. That is certainly true. And, again, just getting the word out and making sure that we are seen. Okay. So, Kara, I'm not sure if we can go to Q&A right now, or if I can talk a little bit more about the resources. It's up to you. Let me know.
Well, let's move into the Q&A. Thank you so much. That's so wonderful and helpful to hear about your work around uh, depression in fathers and first-time dads, and the work with Fathers First. And I think this is a really important topic that people seem to be getting a lot out of. The questions are coming in, so I'm just going to go through a few of them. But keep chatting in if you have other questions. We're going to get through as many as we can. So please discuss what to do when mothers and fathers are both depressed.
Okay. So when moms and dads are both depressed, we certainly want to think about perhaps getting them into some treatment together. You can also provide some treatment separately. I think it also depends on at what stage parents are coming in. Because again, their needs also may be different, but we also want to understand how for both of them, how is their relationship functioning, and also thinking about what needs are in particular so that we can address those things. And again, I think I mentioned earlier that making sure that fathers and moms, I think, need a specific place to really talk about their experiences, both together but also separately. So I think asking them a little bit more about what would be most helpful to them. And then thinking about resources and or referrals that are going to fit their needs.
Wonderful, very helpful, thank you. Any tips on engaging dads? This person said, we tend to have dads engaged at the first visit, and on follow-up, they state they're very busy and can't commit to groups or one-on-one meetings. So do you have any tips on engaging dads?
Yeah, so I think, just going back to what I shared earlier, right? So one, acknowledging that, he may need to work, right? Going back to the provider piece. But also, are there opportunities that you can do with parents, are there opportunities for you to work with parents together? I'm a big fan of sending materials home, right? Because dad is not in the office doesn't mean he's not present, right? So we want to remind him, we want to continue to engage him. If there's information that you can send home with mom to say, hey, we're thinking about you. I would also say, going back to literature that specifically focuses on dad, and it doesn't have to be something super elaborate. It could just be a flyer. I also encourage programs to create something for dads only. You'd be surprised, right? Because oftentimes, perhaps dads don't come back because they don't feel welcomed in the space. And that can be, even just thinking about the physical space that they're walking into. Does this say, that men or dads are welcome here? And if it doesn't, then you want to rethink that. Even thinking about the posters on the wall, what does it say? And then are there other dads in the space? Right? So just, again, thinking through, the times and the opportunities that you can tap into dad who's there. And then also, I'm a big fan of just asking the question, hey, dad, what would get you in here? What are the kinds of things that would get you to participate in this, in a group or in a particular presentation? And then lastly, I would suggest, if there are activities that you can do for both parents together, that may also be an opportunity. I said that was the last one, but also thinking about, hours that are convenient. So sometimes I know that we like to do the whole 9 to 5 thing or 8 to 4, but, if dads are working and they need something after hours, you want to be able to do that as well.
Great, thank you so much. Very helpful. Great advice. The next question is, how can we mitigate stigma that may get in the way of screening dads as well as treatment?
Yeah, that's a great point. So I know that someone brought up child protection services earlier, right? So that folks are often scared and concerned because we know that many people, especially, poor communities or communities of color, haven't always had the best experiences as it relates to authority and as well as child welfare, right? And then also just a lot of judgment around that. So I think that one of the things that we can do is make it part of the routine. And again, having, information that is easily available and easy to read with engaging colors, and engaging slogans that you can share with folks, I think certainly helps to combat stigma around it. And then again, normalizing these feelings, right? That these are not issues just for moms, these are issues for dads as well, and that it's important to the practitioner to hear, what needs they have, because you want to be supportive to not just mom, but you want to be supportive to him and the whole family, because, we are really talking about, having a great start for both parents and the baby.
Yep, absolutely. Thank you. Here's a question about, a lot of people are wondering where they can get pamphlets about PPD. Do you happen to have one you could share and we could post? Or is there a place where we should get one? Mm-hmm.
Yeah, I can certainly find a pamphlet that I can share with you all. But also, you can also make your own at your agency, and just talk. There's some of the feelings or emotions that we mentioned in the earlier slides, to say, are you experiencing any of these things, right? And I would stay away from, information around, the screenings or assessments, but just really make it educational. Hey, Dad, we're concerned about you too during the pregnancy process, and we want to talk a little bit about, how you're feeling. But I can certainly look up some of the PPD pamphlets and share that with folks. I'm certainly happy to do that. And again, making sure that the material, again, is, father specific.
Great. This question kind of aligns with that, about what are some of the languages that we can start to use for a conversation with a dad, with him feeling like it's not a sign of weakness.
Yeah, I think you certainly want to, take good care around not making it feel like it's a sign of weakness, but also acknowledging that these are real and important. And I think, again, what I've heard from dads over and over again is the fact that, the conversations that we have, or the groups that they come into, feel welcoming, people there feel like they care, and that the space itself, so I don't want folks to overlook that either, that the space itself feels welcoming when they come in. And we do all kinds of stuff. So, we make sure that, we do raffles. We provide, one-pagers, just even one-pagers. Some one-pagers are just focused on, dads and work, making time for babies, just some of those things.
Great. Thank you so much. Very helpful. Someone is asking about the use of meditation in the treatment of paternal depression. Do you know anything about that?
Yeah, so I think meditative practices, we know that they can be a helpful tool in working with depression. It is something that we also do in our groups. We do guided meditation, and oftentimes we will start with that. We also have something just along those lines that we've introduced. We have, special guests come in who will focus on meditative practices that dads can employ during the day for them. That's helpful during the day or at home. And then we also, try to do fun stuff as well for dads. So we have someone, yoga specialists who come in to do yoga with our fathers as well. We actually have a different name for it. We call it broga, just to make it a little bit more fun and engaging for dads. So absolutely, those things have been certainly helpful. And so I think that anything that you can incorporate into your practice would be helpful.
Great. So making dads feel visible is really important, whether it's in language or your setting as well. Here's a question about, is there diagnosis and treatment for men who have already struggled with episodes of major depression? So is there a distinction between those who've had depression in the past or struggling with major depression and then happen to become a father versus a man whose depression appears to be new and more specifically correlated to becoming or being a father? So would treatment and diagnoses look different? And do you have anything to say about that?
Yeah, I don't think, I think, with regard to diagnoses, right, we're specifically looking at depression that has come about during the perinatal period, but I think that's where taking a good history comes into play. If they have any history of depression, any histories of trauma, any histories of anxiety, right, we also know that for dads who have a history of depression and anxiety are going to also be more at risk. So if you are working with clients already and you know that this is something that has been a challenge or a struggle for someone in the past, I would say you want to certainly pay a little bit more closer attention to what dads are experiencing during that time. But again, some of the same treatments may be employed. And again, just going back to, interpersonal psychotherapy, CBT, and for those who needed medication, obviously.
Great, very helpful, thank you. I think we have time for one more question and then we'll wrap up. Do you find that due to culture, it's harder for most of the younger dads to be able to open up and talk about these things?
I think that due to culture, yes, right? But I also think that, pregnancy is such a wonderful time because it's a time of opportunity and a time of change, right? So I think that because that time is also so vulnerable, that people are more open and more apt to ask for help during that time and be open to receiving help during that time. I do think that again, going back to some of the information that I shared earlier, that with younger dads, some of the challenges that come up will be around managing the romantic relationship, right? So just to give a quick example, they're not only managing the horizontal relationship with their partner, but they might also be managing the vertical relationship, right? So if this is a family, or his partner's family may not be welcoming about the pregnancy, or they may have had some challenges with the young father in the past. That may make it more difficult for him to be present. Also, again, thinking about an early exit from the educational system, right? We want to encourage dads, even though they may want to work, to be a provider and support their child. We want to continue to encourage them to be connected to the educational system, and then also give them some resources around employment as well, right? Because we don't want them to leave the educational system, but then get stuck in a dead-end job that may not go anywhere. And then we have to, we're dealing with other issues that come along with that down the road. So.
Wonderful. Thank you so much, Lena. You're amazing. Your work is amazing. We so appreciate hearing from you. Do you want to just go over the resources really quickly and then we'll wrap it up?
Okay, sure. My program is called the Acure Center. It's a free community-based social service organization offering group-based services in the community. We have some key principles: encouraging, equipping, connecting, and inspiring. Again, just some of the programs that we provide, again, is the Daddy Boot Camp program, which is a 3-hour workshop, Dr. Dad, which focuses on knowledge and skills they need to be successful for young children from the start. We have 7 Habits of a 24/7 Dad. That is a workshop that is broken up into 1 to 2 hour sessions that focuses on some fundamental fathering principles that we got training for through the National Fatherhood Initiative. So it's a mixture of some of the 24/7 Dad program components, as well as Stephen Covey's 7 Habits program, which is pretty timeless. I'm sure that most people are aware of Stephen Covey's, Franklin Covey's 7 Habits. And then we also offer the 24/7 Dad program, and that's our most comprehensive fatherhood program available. We have innovative tools, strategies, and exercises for fathers of all races, religions, cultures, and backgrounds. It's developed by fatherhood and parenting experts, and it focuses in on the characteristics men need to be fathers 24 hours a day, 7 days a week. So I encourage you all to, and I can share some of the information about these as well with Kara that can be sent out to all of you. But for most of us, I just encourage you to think about and get connected to any community-based programs that may be offering any fatherhood programs out there.
Wonderful, thank you. Yes, somebody's asking if any of these programs are available online right now. So send me whatever you can, sure. And we'll be sure. Oh, great, and we'll be sure to get it out to our participants today. I just wanted to go over some upcoming CTAC events: supporting family and youth peer advocates during COVID-19 this Friday at 12 p.m., helping teen care families cope with ambiguous loss Monday at 12 p.m., Supervisory Best Practice Series, promoting remote supportive supervision, which will happen on Tuesday. And then we have Transition Age Youth Engagement Best Practices and Personal Experience on Thursday, April 30th. I just want to thank you all for participating with us today. And Dr. Lena Green, you're fantastic. We so appreciate your work. I know I've worked with a lot of families and mostly focused on mothers, and so I think it's really important what you're bringing to the field, and hopefully others can start to think about dads and some of their depression and ways to intervene where maybe they didn't before. So we're going to end, but do you have any last thoughts or anything to say to our audience, Lena?
Yes, just thank you for listening. Thank you for joining us today, and I really do hope that some of the information that we've shared today will help you in your practice moving forward with fathers.
Thank you. Take good care, everyone. Have a good day. We'll see you soon. Bye-bye.